Imagine a world where the deadly grip of smoking could be broken, a world where a sleek, glowing vape device promised freedom from the toxic haze of cigarettes, a healthier alternative, even a lifeline to quit. In the early 2000s, vaping emerged as a revolution, a smoke-free future dangling just within reach. But what if that promise was a dangerous lie? What if those shiny gadgets didn't just scar your lungs, but could paralyze you, addict you, and unleash a cascade of hidden dangers? Today, on March 12, 2025, we at BLCKBox plunge into the shadowy depths of the vape industry, a world where claims of health and freedom crumble under the weight of paralysis, addiction, and shocking revelations. Welcome to a story that peels back the curtain on a billion-dollar deception. The story begins with a glimmer of hope. In 2003, a Chinese pharmacist named Han Lik invented the modern e-cigarette, driven by a personal mission to find an alternative to smoking after losing his father to lung cancer.
I'd been doing these experiments in the lab since 2002. I was lucky. After trying out different design methods in constructing the e-cigarette, I found one that worked, so I filed a patent. In 2006, we had the amazing sales volume. We sold about 200 million e-cigarettes. When our first generation e-cigarette hit the market, we were the world's first and only manufacturer and retailer of e-cigarettes.
By 2006, e-cigarettes hit the U.S. market, marketed as a safer option to traditional cigarettes, which contain over 7,000 chemicals, including 93 known to be harmful, according to the CDC. The vape industry, fueled by clever marketing, pitched a dream, a device that delivers nicotine without combustion, without tar, without the carcinogenic smoke that kills millions each year. Early adopters saw it as a game changer, a way to sidestep the deadly legacy of big tobacco. Companies like Juul, launched in 2015, positioned their products as smoking cessation aids with slogans radiating health, freedom, and modernity. By 2014, vaping had exploded, especially among youth. Usage among high school students surged from a mere 1.5% in 2011 to over 13% in just a few years, according to the National Youth Tobacco Survey. It seemed like a triumph, a way to break free from big tobacco's grip. But was this truly a breakthrough, or the start of a new nightmare? Let's dissect the early claims. The vape industry's pitch rested on the idea that e-cigarettes were less harmful than cigarettes because they avoided combustion. Traditional cigarettes burn tobacco, releasing tar and carbon monoxide, but vaping heats a liquid, e-liquid, into an aerosol. No ash, no fire, no problem, right? Not quite. E-liquids contain propylene glycol and vegetable glycerin, humectants that create vapor, but when heated, these break down into toxic carbonyl compounds like formaldehyde, acetaldehyde, and acrolein, chemicals linked to lung irritation, cardiovascular damage, and even cancer. Juul pods, a teen favorite, packed nicotine levels equivalent to an entire pack of cigarettes per pod, often masked in enticing flavors like mango, mint, and cotton candy. The industry insisted this was safe, touting early studies that showed fewer toxins than cigarette smoke. But those studies were often short-term, ignoring long-term effects, and many were funded by the vape industry itself. Was the industry banking on hope or hiding something far more sinister? The cracks in the facade appeared swiftly. By 2018, vaping had become a cultural phenomenon, with vape shops popping up on every corner and online communities celebrating the vape life. But whispers of health risks grew louder. Then, in the summer of 2019, a crisis erupted, an outbreak of E-Valley. E-cigarette, or vaping-associated lung injury, swept across the U.S. hospitals, reported a surge of patients, mostly young adults and teens, with severe lung issues, chest pain, shortness of breath, coughing up blood, and in extreme cases, acute respiratory failure. Some victims faced even graver consequences, paralysis, possibly from neurological damage caused by toxic aerosols. The CDC documented over 2,800 cases and 68 deaths.
The CDC is now reporting more than 800 confirmed and probable cases of lung injury associated with using e-cigarettes. At least 12 people have died. Nearly 3/4 of the cases are men, and most patients are 18 to 34 years old. Federal health officials still don't know the cause and haven't found a product or substance linked to all cases. but most patients had a history of using vaping products containing THC, the psychoactive ingredient in marijuana. The CDC recommends people consider not vaping if they have concerns about these health risks. And if you do vape and have symptoms such as cough or shortness of breath, see your healthcare provider. Dr. John LaPook, CBS News, New York.
By early 2020, linking many to vitamin E acetate, a thickening agent in illicit THC vape products. But the danger wasn't limited to black market goods. Legitimate e-liquids contain the same base chemicals, propylene glycol, glycerin, that broke down into formaldehyde and acrolein, penetrating deep into lungs. Young people who thought they were choosing a safer option ended up on ventilators, their lungs scarred by substances the industry had downplayed for years. Was this an unforeseen side effect, or a risk the vape industry knew about all along? Let's rewind to the rise of vaping's popularity. Juul, founded in 2015, became the face of the industry, growing from a startup to a company valued at $38 billion by 2018. Their secret? Aggressive marketing aimed squarely at youth. Juul's devices were sleek, discreet, and USB-like, easy to hide in a backpack or even a classroom. They flooded social media with influencers paid to promote vaping as cool, trendy, and harmless, often using hashtags like Vape Life. By 2018, nearly 1 in 5 U.S. teens vaped, a 73% increase in just 4 years, according to the FDA. Flavors like bubblegum and fruit punch drew in kids, masking the harshness of nicotine. But here's the kicker: Juul pods delivered nicotine at levels far higher than most cigarettes, with some pods containing as much as 59 milligrams per milliliter, enough to hook users fast. The industry claimed they weren't targeting minors, but internal documents later revealed otherwise. A 2020 Netflix documentary, Big Vape: The Rise and Fall of Juul, exposed how Juul's founders prioritized growth over safety, even as they knew their product was addicting a new generation. Was this a reckless oversight or a deliberate strategy to create lifelong customers? The health risks kept mounting, far beyond E-Valley. Studies in 2022 revealed that long-term vaping impairs blood vessel function, mirroring the damage caused by cigarette smoking, and combining vaping with cigarettes doubles the cardiovascular risk. Teens reported rapid heartbeats, anxiety, and memory issues, effects of nicotine on still developing brains, which don't fully mature until age 25. Some users faced neurological disorders, including seizures linked to high nicotine exposure. Others suffered from chemical burns when e-cigarettes exploded due to faulty lithium-ion batteries, with incidents reported as early as 2016, causing severe injuries like broken jaws and burns. Perhaps most alarming were cases of paralysis, potentially tied to neurotoxic effects of inhaled chemicals like acrolein, a herbicide also used in e-liquids. A 23 case study documented a 19-year-old who lost mobility in his legs after years of heavy vaping, with doctors suspecting nerve damage from toxic aerosol exposure. These weren't isolated incidents. They were warning signs of a broader crisis. How could an industry claiming to save lives ignore such devastating consequences? The psychological toll on young users added another layer of darkness. Vaping didn't just harm bodies, it hijacked minds. Nicotine, a highly addictive stimulant, alters brain chemistry, especially in adolescence. A 2021 study from the American Academy of Pediatrics found that teen vapers were twice as likely to experience depression and anxiety compared to non-users, with some reporting suicidal thoughts linked to withdrawal. Social pressure amplified the problem. Vaping became a status symbol, a rite of passage, fueled by peer influence and social media. Teens who started vaping to fit in found themselves trapped, unable to quit without facing debilitating cravings. Parents reported behavioral changes, irritability, lack of focus, even aggression, as their children battled addiction. The industry's promise of freedom had morphed into a prison, locking a generation into a cycle of dependency. Was this the liberation vaping promised, or a new form of exploitation? Regulatory response lagged far behind the crisis. In December 2019, the U.S. passed the Tobacco 21 law, raising the minimum age for purchasing vape products to 21, but enforcement was spotty.
I am proud to announce that today, Congress has passed Tobacco 21. This means that the tobacco sales age, including e-cigarettes, will increase to 21 years old across the United States. Our advocacy work at the American Lung Association helped strengthen the bill to make sure there were no exemptions or loopholes. We are so thrilled and want to thank everyone who has supported us in this long and rewarding journey. Even though this is a fantastic reason for celebration, we still have work to do. That includes clearing the market of all flavored tobacco products, strengthening smoke-free air laws, and helping people end their addiction to nicotine. I feel so grateful to be a part of this organization that works every day toward our vision of a world free of lung disease. Thank you to everyone who helped make this an historic day.
The FDA began cracking down on illegal flavored products in 2020, targeting the mango and bubblegum flavors that lured teens, but the damage was done. A 2023 CDC report showed that 2.1 million U.S. teens still vaped, down from a peak of 5 million in 2019, but still a staggering number. Worse, studies revealed that vaping often led to cigarette smoking, not away from it. A 2022 study found that young vapers were 4 times more likely to start smoking traditional cigarettes within 2 years. The industry's claim that vaping was a cessation tool crumbled under this evidence. Meanwhile, secondhand aerosol exposure raised new concerns, with the American Lung Association warning of nicotine and carcinogens in the air around vapors. Why did it take so long for regulators to act? And were they too influenced by the vape industry's lobbying power? Let's dig into the industry's tactics. The vape market, valued at over $20 billion by 2024, thrived on deception. Internal documents from Juul, leaked during a 2020 lawsuit, showed executives knew their marketing appealed to teens, despite public denials. They paid influencers to promote vaping on Instagram and Snapchat, platforms dominated by young users, while claiming their goal was to help adult smokers quit. Health organizations like the WHO warned early on, nicotine harms brain development, and aerosols contain carcinogens, but the industry countered with studies labeling their products less harmful. A closer look reveals many of those studies were funded by tobacco or vape companies, casting doubt on their objectivity. Independent research painted a grimmer picture. A 2024 study found that e-cigarette aerosols contain heavy metals like lead and chromium, leached from device coils, posing risks of chronic lung disease. Were we misled, or did the industry simply not care about the consequences? The aftermath is a grim reality check. Millions of teens remain addicted, facing lifelong health risks. Vaping rates have dipped slightly, but the damage lingers. Users report chronic coughs, reduced lung capacity, and early signs of heart disease. Canada and Europe have imposed stricter regulations, banning most flavored vapes and capping nicotine levels. But the U.S. market remains a wild west, with new products flooding in despite FDA oversight. Companies continue to innovate, pushing disposable vapes that evade regulations, often marketed as healthier, with no proof. The promise of vaping as a safe alternative lies in tatters, replaced by a legacy of addiction, illness, and broken trust. Was this a well-intentioned experiment gone wrong, or a calculated move to hook a new generation while hiding the dangers? The question remains, were we deceived? The vape industry began with a pledge of health, but the truth, paralysis, addiction, cancer, has surfaced, piece by piece. At BLCKBox, we're committed to uncovering the hidden stories that matter. What do you think? Did the industry know the risks, or were they as blind as we were? Share your thoughts below, and let's keep digging for the truth. To all the young people watching, I have a message for you. The dangers are real, and they're terrifying. Vaping can scar your lungs, damage your heart, and even paralyze you, as we've seen in cases around the world. Nicotine addiction can trap you, altering your brain, your mood, your future, stealing the freedom you deserve. Smoking is a proven killer, but vaping isn't the escape it pretends to be. It's a new trap, built on lies. You're worth more than the profits of an industry that doesn't care about your health. Protect your body, your mind, your life. Say no to vaping and smoking, and share this truth with your friends. Together, we can break this cycle. Thank you for joining BLCKBox on this journey. If this story gripped you, please like and subscribe. Stay curious, keep seeking the truth, and we'll see you in the next one.